Hello again. I'm Fatimah Kahiga, owner of Pure Skin Solutions here in Aurora, Illinois. And today I am going to be discussing chemical peels and serums. Now, I chose to discuss chemical peels and serums because it is officially fall. I don't really consider September fall when it hits, when the equinox comes, but um, it is now fall. It is looking like fall out here in Aurora, Illinois. Well, Illinois, period, I'm sure. And it's feeling like fall, most importantly. So, the reason I'm discussing chemical peels and serums is because during the summer, we've spent all that time baking our skin to oblivion. And now it's time to exfoliate that old skin as much as we can and bring our new skin cells to the forefront so we can have a nice, fresher look about ourselves. Um, so I'm going to go ahead and discuss, again, chemical peels, serums, like the types of peels. We're going to talk about some benefits. And of course, we need to discuss contraindications just because not everybody can get a peel. So anyways, chemical peel or chemical exfoliation is the process of removing excessive dead skin cells, and it's from the corneum layers of the skin. And you do this by use of acids. Now, most people, when they hear the word acids, it almost makes them cringe, like, ooh, what kind of acid is she using? People, I think their mind goes straight to sulfuric acid, which pretty much eats away your body. But no, it's not that serious. It's not that strong either. But they are strong. There are generally two types of peels. The first one is a light peel, and that's what we estheticians or cosmetologists, we typically use those in a day spa. Chemical peel, chemical exfoliation, those are used interchangeably. It just depends on the environment that you use it in. So just for legality purposes, I know in Illinois, we are not allowed to use chemical peels if we're a licensed esthetician and we're not being supervised by a medical professional. So in a day spa, they would normally say chemical exfoliation. But you can say chemical peel as long as the peel is not a certain strength, because once you get to a certain strength, then that's when you need the supervision from the medical professional. So the light peels, they're designed to penetrate the epidermis, which are the top 5 layers of your skin, and they shouldn't go any further. If they do, again, I hope you're supervised by a medical professional here in the state of Illinois. Second type of peel is the medium to deeper peels. And these peels are designed to penetrate through the epidermis, so all 5 layers, as well into the dermal layers. So you have the epidermis and then the dermis, and that's where the peel should penetrate through. It should not penetrate any further because those skin cells are not dead in the dermal layer. That's like your blueprint of what your skin is looking like. So if you go and treat that and kind of wipe it out, that's kind of how your skin's going to end up looking. It will be a little sensitized if you go too deep with the peel, but that's one of those factors you have to consider when getting a deep peel. And these are the type of peels, if you're going to a medical spa where they do have doctors, physician's assistants, or nurses, or all of the above, you'll see these type of peels a lot more than the ones that are more superficial. Now, don't knock the ones that are superficial. Superficial. Don't knock the ones that are superficial, because those actually work. Like, they work really well, and you do peel off of them. So They are generally made up of AHAs or alpha hydroxy acids and BHAs, beta hydroxy acids. Your typical alpha hydroxy acid is your glycolic acid, your lactic acid, your citric acid, and your BHAs or beta hydroxy acids. The most common one would be the salicylic acid. And I believe in a last episode that I said that salicylic acid is a alpha hydroxy acid. I need to retract that statement. It's actually a beta hydroxy acid. It's a good strong acid. I like it. It's great for acne because it goes in and cleans out the pores really well. But it's derived from aspirin, so not everybody can use it, especially us pregnant ladies. Anyhow, so those are the two main ones. The benefits is it improves the texture of your skin. I did a lady today, and usually I always ask them to get it done in the series because they're not going to really tell the difference the first time unless it's a really, really deep one. So this is her second series, her second one in the series. And as an esthetician, I know what to look for, and I've already seen a good change in her skin. She has a few acne scars, and unfortunately, like those type of peels, I just have light peels at my spa. So if her acne scars are shallow enough, it can help with the texture, but if they're too deep, then she has to go to somewhere like a medical spa. Unless she just wants to get peel after peel after peel with some microderm, and that's a lot. But anyways, it also helps with moisture retention. Again, you're in the fall season now, and when the fall season comes, the skin gets drier, especially when you have that old fried skin from the sun's rays. So you need to hurry up and exfoliate that, get that moisture pumping, and let that be, let your skin heal, properly. Second, it does increase your cell turnover rate. So this is really, really good for our older clients who are dealing with some type of aging, or people who are dealing with premature aging. This definitely helps smooth out those fine lines and wrinkles. It helps with surface pigmentation. So my clients who have the hyperpigmentation, aka uneven skin tones, because a lot of people don't know what that means. You have the dark marks. Now, hypopigmentation, those don't help. But the hyperpigmentation, hypo is when you have the light spots. And that's basically an absence of melanin, in which your melanocytes just stop producing, or they died somehow, or they're not there. So unfortunately, I can't help with that, or I don't even know who could help with that. But hyperpigmentation, in which you have the darker spots, those do. The peels actually help with that. It helps brighten up your skin. And that's another thing that I saw in my client today, because she was suffering from the texture, the acne scars. She says she had fine lines and wrinkles, but everybody's their own worst critic. And she also had a little bit of hyperpigmentation from the sun. You get those sun spots, the little brown spots. So she did have a little bit of those, but her skin's looking really good, and I can't wait to see her for her third chemical peel. This also, again, it improves the acne. It improves clogged pores. And because, again, your skin is peeling, you're trying to peel off some layers of skin, that helps open up those pores a little bit more to get all the debris out. And not everybody has clogged pores, but a lot of us do, especially the oily clients. I have a client who owns a plant nursery, so she has dirt. She has the good kind of dirt in her pores, like soil. And I clean those out all the time. I haven't given her a peel just yet, but she's been getting microdermabrasion, and that's when I clean them out. So I'll see if she wants a peel after we finish her series of microdermabrasions. And last but not least, another benefit of a peel would be they have the potential to stimulate elastin and collagen production. So what this means is you are more likely to have plump, firm skin with a really good snapback, snapback. So that's always a great factor when considering a chemical peel. And I just hope, it's not too intimidating for some people when they hear the word peel, because a lot of people do get scared. And then when they feel it, it has more of an itchy burn. So it itches all over your face. But if you were to scratch it, it's probably going to make it worse. So it does, so that's the kind of, it's like a tingly, itchy, burny feeling, but it's not going to kill you. And just make sure you have, something to fan yourself if it gets to that point. I keep a fan for my clients' comfort, but that's just me. Anyhow, but not everybody can get peels. So who cannot get peels? People who have had recent cosmetic surgeries, to their face. And I'm talking about the lifts, the nose jobs, whatever you get done to your face, anything pulled back. You would need to wait, and you would need to discuss this with your doctor to see when you're eligible to get a peel. If you had some kind of laser resurfacing, you need to wait. Any kind of injectables, a little nip here, tuck there, the Botox, the derma fillers, I tell people all the time, you got to wait. And again, you talk to your doctor and ask them when you should wait, because I don't know all that you've had done. And usually, I'm not going to say usually, but most of the time, my clients, or just clients in general, they don't know. They don't ask the right questions, or they don't even inform the doctors that they're about to have another procedure done, just to let them know. Like, I have a client, I gave her a chemical peel, and she's like, oh, next week can I come in for the microblading? No, you cannot. You absolutely cannot. No, you're not. We're not about to compromise your skin. You just had a peel. So no, we're not about to microblade your brows right now. Let's give your skin a rest, let those cells reproduce, get you some nice skin, and then I can microblade you. But right now, no. I love money, but I'm not in love with money, I guess. Anyways, people who use any kind of exfoliating medications, Retin-A is a good one that exfoliates the skin. I want to say Accutane is one of those medications as well. It definitely dries out your skin. It's a very strong drug, so I would discuss this with my doctor as well when it comes to using that medication. But any medication that's already exfoliating your skin, throwing a chemical peel on top of it is not going to do anything but sensitize your skin. It's probably going to burn, and you'll probably have adverse effects from the chemical pills. So you just need to really do your research. You need to discuss things with your medical provider. If you have any kind of outbreak of herpes simplex, if you have some type of inflamed rosacea or acne, well, acne, we'll put an asterisk by that, because there are some chemical pills that you can use to spot treat acne. It just depends on the product line. And with that, you just don't know. You would have to do your research. There are some that can handle it, and it helps calm down that acne. that inflamed acne. And the same thing with pregnancy, because they say when you're pregnant, you cannot get a chemical peel. I found chemical peels from product lines that are good for pregnant women and people with sensitive skin without the use of salicylic acid. And I'm going to give myself one after this episode. So, again, just do your research on the product line if you're going to get one, or just ask the person. Usually the esthetician would know, or the dermatologist, whoever, whoever's providing the service. If you have any open sores, of course, you should not get a chemical peel. Open sores, it'll burn for sure. Again, sunburns or irritated skin, it's only common sense that you do not want to put a chemical peel on this, because a chemical peel is essentially a controlled burn. So if you already have burned skin or irritated skin, why would you want to burn it even more? But some people don't think like that. So you do have to kind of break it down, in, I guess, layman's terms for people like that. But that is pretty much it as far as like that for the most part for people. There's always, a special case in which people can't get it. But again, that's where you go with discussing things with your medical provider. And the best part to me about chemical peels is you get the grand opportunity to treat them. And how do you treat them? With serums. So serums, according to like the book, it's a concentrated liquid ingredient for the skin designed to penetrate and treat various skin conditions. So again, in the fall, our skin is dry. There are several types of serums. There's a hydrating serum, anti-aging serum, anti-acne type of serum, things for any kind of skin condition, usually sensitive skin serum, or even serums for rosacea. There's eye serums, lip serums, because again, in the fall and the winter, our lips get very dry, they get chapped, and we don't know what to do. We're like, I'm using chapstick. It doesn't work. Sometimes you need to have a lip treatment. You need to exfoliate those lips, and you need to put sometimes there's a serum for it, or you can use a really, really good quality lip balm. I can't really recommend what brands to use, but I would ask an esthetician. All right, so again, serums treat your skin, and they are generally applied under your moisturizer, under a mask, or under a massage cream, because these are broken down on a molecular level. So they're formulated with smaller molecules that are able to penetrate like through your epidermis, so deeper into your dermal layers, like deeper into the skin. People tend to think that moisturizers are what's supposed to keep their skin moisturized. Yes, it is, but that's not really the job of a moisturizer. Moisturizers definitely help, but they don't do what a serum does. Again, serums are broken down smaller, and so they penetrate deeper. And what the moisturizer does usually is it locks it in or just keeps it in there. So that's why a mask locks it in or keeps it inside of your skin as well. And of course the massage cream, because you're massaging everything deeper into the skin. And again, this is what helps treat any kind of skin condition that you may have. I always say a good hydrating serum is, to me, the best way to go if you don't know. anything else. A good hydrating serum, because 9 times out of 10, when people with skin conditions come in, their skin is dehydrated. So you want to help hydrate that skin, regardless if they have acne or not. People think, oh no, my skin is so oily. There's oily and dehydrated, and then there's oily and hydrated. Most people are oily and dehydrated when I see them. Anyways, so that's what you would use, and what I always advise people to do when it comes to serums is don't rub it in your hands like this, because your hands just absorbed a lot of that serum. Once you squirt it in your hands, or deposit it into your hands, just put it directly on your skin and start to press it in at first, and then you can start to rub it all around and inside, because you want to get it on your face. You want to get most of that serum especially in the area that you are experiencing some kind of issue with. So just be mindful of that. And then just try to top it off with something, usually a moisturizer. And the moisturizer definitely helps protect your skin against the elements, so you don't want to compromise, especially after a chemical peel. Also, I forgot to say this, make sure you're using some sunscreen after your chemical peel, regardless of what the weather's looking like. Again, I did a chemical peel today. I gave that lady, I gave her some SPF 50 and, of course, with other things, moisturizer, mask, serum, all that. And I sent her on her way. And it is as cloudy as Illinois is. Illinois can be cloudy, especially, it's fall. So even though we don't see the sun is still in the sky, and its rays filters through the clouds, and sometimes on a more magnified level. So it can do more damage when you don't see the sun during the day. So I sent her on her way with that, but I'm sure she's loving her skin. She should be anyways. And that is about it for our lesson on chemical peels and serums. Just make sure you don't get them during the summertime. You will ruin your skin trying to exfoliate your skin so deeply during the summer months, because I'm not going to say but a lot of people are not that disciplined to avoid sunlight. And it's really difficult. So get it when the sun is the least in the sky. If you're living in the Midwest, I'd say between October and March, maybe April. If you live in Florida, you have a very small window to get that done. I don't even know. I haven't lived in Florida in 4 years, so we used to barbecue or grill out on Christmas. The sun would still be out. I would say around January, February. That's when you probably would feel, or you can do it in December. You just be careful and discuss it with your esthetician or whoever's doing it. But if you're in an area like I am, where we get a lot of cold weather throughout the year and the sun's not in the sky as much throughout the year, then the windows open a little bit longer for you to get this type of treatment. But that is it. I hope you guys learned something, and you can discuss things with your esthetician or medical provider about this particular service. I love this service. It's a good service to help exfoliate all that nasty skin, dead skin. And I'm 9 months pregnant, so I'm gonna get this one in until and wait for this baby to come, and then I'll probably use the stronger stuff later on. So I will see you guys probably in December. I'm going to skip next month because, again, I am 9 months pregnant, so I'm due to deliver any day. And I just know I have to get my priorities straight. So hope you'll miss me. If not, oh well. I'll be back in December. And you all have a very, very good Halloween and Thanksgiving. And moisturize, drink a lot of water, and be good to one another. Take care.